A viewer wrote in a comment that she seemingly unknowingly hyperventilates, causing her symptoms. How can this be fundamentally changed? Hyperventilation is primarily a physical or anatomical process controlled by the automatisms in our body. These automatisms work through a complex structure of various receptors that target our breathing center in the brain. This means that the breathing process is largely unconscious and automatic, and we do not need to actively control it. Accordingly, hyperventilation can also occur in the background, without our conscious structure being able to access it when we look at the dynamics of hyperventilation, which is actually an automatic function of the body. Why is this topic so important to us? We often deal with symptoms like dizziness, drowsiness, and derealization. Hyperventilation can create a subjective feeling of shortness of breath, even though there is enough air available. Typical phenomena are the urge to take deep breaths, a cough reflex, and inner restlessness. These conditions are usually the body's reactions to various factors and are generally not pathological. Our breathing not only provides a supply of oxygen, but also regulates and corrects the pH level in the body. During hyperventilation, we generally breathe faster, which results in more carbon dioxide being expelled. Since carbon dioxide is an important buffer substance for the pH value in our body, in our blood, its reduction leads to vasoconstriction, which can cause symptoms like dizziness and drowsiness. So, what can you do to combat possible hyperventilation? First of all, it should be medically clarified whether your symptoms are actually caused by hyperventilation. Often, however, no clear organic causes are found for the mentioned symptoms. A central cause of hyperventilation can be mental or emotional stress, because it is often exactly these stresses that lead to an increased stress hormone release and cause accelerated breathing. One way to break out of this cycle is to first slightly reduce the breathing rate. Breathing exercises can help you calm your breathing and lower your pulse. In the long term, you should definitely try to identify possible triggers on the mental level. It can be helpful to recognize corresponding thought patterns that cause increased stress hormone release. My most important video will help you recognize these thoughts, to process and cope with them. Without such identification of these triggering thoughts, it can happen that you chronify in your hyperventilation. To manage hyperventilation, breathing exercises can help lower the breathing rate and calm the pulse. In the long term, it is important to identify and address triggers on the cognitive or mental level. This can be achieved by observing and analyzing one's own thoughts and stresses in order to gain better control over the stress hormone release and thereby over the hyperventilation.
Have you already seen my most important video for you? You will learn to understand your symptoms and find the path to change. Feel free to also watch this video here. Like the video, subscribe to the channel, and activate the bell to always stay informed about the latest posts.